Welcome to Doggy for Life, where we talk about what really matters in your dog's health, behavior, and well-being. Today, we're going behind the scenes, into the exam room, and exposing the things pet owners do that secretly make veterinarians cringe. Vets are professionals, and most won't tell you when something bothers them. But that doesn't mean it doesn't happen. Whether it's well-intentioned mistakes or plain bad habits, some things make your vet shake their head, silently, of course. Subscribe my channel if you like the video, and let's count down the 10 things you might be doing that your vet wishes you'd stop. Number 10. Saying, "My dog hates the vet," before you even walk in. The moment you enter the clinic and announce that your dog hates the vet, you're already setting the tone, and not in a good way. Vets and their staff are trained to make animals feel comfortable, even in stressful environments. But when owners pre-label their dogs as aggressive or anxious, it limits what the staff can safely do and how your pet will be treated. It also puts everyone on edge, including your dog. Animals are sensitive to your tone, and if you're already expecting trouble, your pet picks up on that anxiety and acts accordingly. Vets cringe not because your dog is difficult, they've seen it all, but because they wish you'd give your dog and them a chance before jumping to conclusions. Number 9. Self-diagnosing using Google. Walking into a vet clinic and saying, "I looked it up online and I think it's," is one of the biggest silent cringe moments for any veterinary professional. While it's great to be informed, using internet articles or forums to diagnose complex medical issues can be misleading and even dangerous. Veterinarians train for years to understand not just symptoms, but what lies beneath them. When you try to match symptoms with online checklists, you might miss important details or suggest treatments that are ineffective, harmful, or irrelevant. It's not that vets dislike informed clients, they actually appreciate them, but they hope you'll trust their expertise more than a search engine. Subscribe my channel if you like the video, especially if you want the truth behind what your vet is really thinking. What's even more frustrating is when pet owners become so convinced by something they read online that they start challenging every step the vet takes. This turns the appointment into a debate instead of a consultation. Vets want to educate and involve you in the decision-making process, but not battle misinformation at every turn. Bringing up what you've read is fine. In fact, it can be helpful, but it should be part of a conversation, not the foundation of your dog's treatment plan. Trust isn't just about following blindly, it's about respecting the experience, tools, and training that your vet brings to the table. Number 8. Arriving late and still expecting full service. Veterinary schedules are packed, often down to the minute. When a pet owner shows up 15 or 20 minutes late and still expects a full exam, diagnostics, and answers to all their concerns, vets quietly cringe. It's not just about time, it's about respect for the staff, other clients, and your pet's proper care. In most cases, rushing leads to missed symptoms or half-done evaluations. While vets will never show frustration on the outside, these moments force them to cut corners they don't want to, and that's stressful. Arriving on time shows you value the care your pet is getting and that you understand how complex their job really is. Number 7. Letting your dog roam free in the exam room. It might seem harmless to let your dog wander around the exam room, sniffing everything and hopping on furniture. But to a vet, it's often a silent safety concern. Medical equipment, sharps, and even cleaning chemicals are stored within reach. A curious dog off-leash can cause damage, get injured, or make the room unsafe for the next patient. More than that, vets need control during appointments, both for your dog's safety and for an accurate exam. When dogs aren't restrained, it's harder to listen to heartbeats, check joints, or even get close without startling them. Vets may smile and work around it, but inside, they're wishing you'd just keep the leash on until asked. Number 6. Using human medications without asking first. Giving your dog human medications without veterinary approval is one of the most dangerous mistakes owners make, and one that always makes vets cringe. Over-the-counter painkillers like ibuprofen or acetaminophen can be toxic to dogs, even in small doses. The intent might be to help, but the outcome can be organ damage or worse. Even medications that seem mild, like allergy pills or digestive aids, can interact negatively with your dog's system or existing treatments. Your vet wants to help you manage your dog's discomfort, but they also want to prevent emergencies caused by good intentions. Always check first, A quick call can save your dog's life. Number 5. Saying, "He never bites," while holding him tightly. Vets hear it all the time. "He won't bite, I promise," as the owner grips the dog in a nervous chokehold. This contradiction is a red flag. Vets are trained to read body language, not just the dog's, but the owner's too, and when you're tense, your dog usually is too. No matter how sweet your dog is at home, a clinic environment is different. The smells, sounds, and handling can trigger fear-based reactions, even in calm dogs. When owners insist their pet is harmless, while clearly unsure, it puts everyone at risk. Vets appreciate honesty and would much rather use a muzzle temporarily than deal with an unexpected bite. Number 4. Skipping preventive care and only showing up when it's serious. Many pet owners only visit the vet when there's an emergency. While that seems logical, it actually limits your dog's health outcomes. Vets silently cringe when they see dogs with advanced conditions that could have been prevented with regular checkups, dental care, vaccines, or parasite control. Preventive care isn't just a moneymaker. It's the most cost-effective and compassionate way to ensure your dog lives a long, healthy life. When owners treat vets like mechanics instead of medical partners, it creates frustration on both sides. Building a relationship with your vet before something goes wrong can make all the difference. Subscribe my channel if you like the video, especially if you want your dog to live better, not just longer. Number 3. Letting children handle the dog during the exam. Bringing your kids to the vet can be fine, until they're the ones trying to help hold the dog. This might seem cute or involve them in pet care, but vets silently cringe when children are put in charge during an exam. It's unsafe for the dog, the child, and the vet. Handling an animal during a medical exam requires skill and calmness, two things children can't always manage, especially if the dog squirms or panics. Vets worry not only about botched procedures but also about potential injuries. They understand you're trying to involve the family, but when it comes to exams, let the trained professionals do the handling. Number 2. Downplaying symptoms or forgetting important details. Vets rely heavily on your observations to diagnose your dog. But when owners leave out key information, like vomiting, appetite loss, or a recent accident, it makes their job harder. Some people don't mention things because they think it's not a big deal, or they're afraid of being judged for waiting too long. But vets aren't there to judge, they're there to help. Leaving out symptoms only delays treatment or leads to incorrect assumptions. When owners casually say things like, "Oh, yeah, that's been going on for a week actually," after the exam has started, vets often cringe on the inside because time and honesty are both crucial in pet care. Number 1. Acting defensive about cost without asking for options. Veterinary care is healthcare, and like all healthcare, it comes with costs. But vets silently cringe when pet owners get defensive about price before even asking what's involved. Rolling eyes, sarcastic comments, or comparing vet bills to human healthcare, especially when human care is often subsidized or insured, creates unnecessary tension. What vets wish more owners knew is that they often have options, payment plans, alternative treatments, and tiered approaches to care. Instead of shutting down the conversation, asking "What can we do within this budget?" shows mutual respect and opens the door to realistic solutions. Most vets genuinely care about your pet, but they also work in a business that needs to survive to keep helping animals. Being a responsible pet owner isn't just about loving your dog, it's about understanding how to work with your vet to give your dog the best possible care. If you've done one or more of these things, don't worry, you're not alone. What matters is knowing better and doing better. Subscribe my channel if you like the video, and stay tuned to Doggy4Life for more inside info, behavior tips, and real talk about what your dog needs most. Thanks for watching, and next time you visit the vet, maybe make them smile instead of cringe. If you enjoyed this video, make sure to give it a thumbs up. It really helps the channel grow and lets us know you want more awesome content just like this. And if you're new here, don't forget to hit that subscribe button and turn on the notification bell so you never miss an upload. We've got tons of exciting videos coming your way, from funny dog moments to tips, tricks, and all things canine. We're building a positive, dog-loving community here at Doggy4Life, and we'd love to have you be a part of it. Got thoughts or questions? Drop a comment below. I read every single one and love hearing from you. Until next time, stay positive, hug your pup, and remember, once a dog lover, always a dog lover.